let's move on to the last one. So this one's always fun. You know, when I'm looking for topics, I'm always searching articles. And I mean, there's good articles out there and there's bad articles. I think this one is not the best one I've ever read, but it was interesting. So this is a guide to plastic surgery after significant weight loss. And this comes from an article that caught my eye when I was doing research for the show. I'm going to throw a picture of that article up there, Charles, if anybody wants to see it. I didn't love the article. There wasn't really a lot of substance there and maybe a little bit of bad information. So, I mean, check it out if you want. I'm going to kind of go over it. So, I'm going to talk about what they talked about and some of the things that I liked and didn't like. What do you guys think? You guys know. What do you think are popular plastic surgery after weight loss is?
Tummy tucks.
Yeah, it's gonna be number one. That's what I think is number one for sure. That's what I see the most of. That actually was their number one, tummy tuck.
Breast lift.
Huh?
Breast lift.
I think that's number two. They didn't even mention that one. To me, that's number two is breast lift plus or minus implants. Yeah, you can have my job. I can train you how to do it. You just step right in. So they talked about tummy tuck. Some of the stuff that was interesting, they stated it had a 98% satisfaction rate. I would believe that. I think it's very rare that people go through tummy tuck and aren't satisfied with it. What was interesting is they stated there was a 33% risk of seroma or hematoma. So seroma
Are those like hernias almost or something?
No, hematoma is bleeding.
Okay.
So it'd be post-op bleeding.
Oh, okay.
Seroma is the risk of fluid collecting on the inside.
Oh.
So.
Well, don't you I've seen people when they have tummy tucks, they have like these like fluid things coming out.
The drain
of
tubes.
Them. Yeah.
Yeah. About 90% of plastic surgeons use drain tubes. If you use a drain tube, the risk of seroma should be zero because that's exactly
what it's for.
Yeah, that's what the drain's for. So I didn't agree with that risk strata. That was crazy. 33% risk? No. To me, the biggest risk of tummy tuck is healing problems on the incision, far and away. So I don't know where they came up with that. So their number two is liposuction. I don't know why they would say liposuction for somebody who's had a massive weight loss. It's almost never done by itself after weight loss. In fact, their biggest problem with people after weight loss is
Extra
loose skin.
Yeah.
And like liposuction makes loose
it worse.
skin worse. Like I don't know why they would even mention that one. I mean, occasionally I'll do liposuction in conjunction with a skin removal surgery, but honestly not that frequently
Maybe
with
like
weight
with
loss
like
patients.
The areas where they're like fat loss, it's like contouring liposuction.
Yes,
more.
yeah, contouring liposuction. Yeah, I do that a lot with tummy tucks, but mostly on people who haven't had the weight loss. They talked about body lifts. So that would be like a tummy tuck with the butt lift or going all the way around. I disagree with that one. Very few people get butt lifts. I mean, they do happen. I make people break those apart. I don't do full body lifts. I mean, part of that's just because I've been around for so long and I'm so busy, I can be selective. To me, the complication rate's just too high.
Seems like you do a butt lift and it's like you can't, how are you going to like lay there and recover
I
and
do not
rest?
like full body lifts.
You have to like lay on your side.
To me, the risks are much too high.
Yeah.
They talked about brachioplasty or arm lifts. It was weird. They recommended doing lipo first and then the skin resection. No, I don't agree with that at all.
Whatever surgery it is that like fixes like extra skin around your face.
Neck lift?
Yeah.
Yeah, neck lift. Yeah, we'll talk about that one, yeah. They say there's a 15% infection rate for arm lifts and a 10% reoperation rate. That's crazy.
What doctor's office are they going to?
I don't know. So I didn't really agree with their list. I mean, I agree with some of them. And some of the stuff that they mentioned, you know, I just didn't agree with. But for me, you mentioned it, most popular plastic surgery after weight loss, tummy tuck, breast lift. I do think arm lifts and thigh lifts are up there. Facelift and neck lift occasionally. You know, the face is usually not as affected as much as the body with weight loss. That's why it's not quite as high up there. And then occasionally buttocks lifts. I just did one the other day. So they do happen. It's just there's not a ton of people that need them. And I would never do them at the same time.
Yeah.
So anyway, yeah, I mean, it was kind of an interesting article. It's about something I specialize in. So I was like, some okay information there, not the greatest. This was better information.
Yeah.
Better. So
I agree.
Good to know. All right, I think we've about used up all our time today. Please leave us a comment. Let us know there's anything that you would like us to talk about on the next episode of Nip Talk, and we will see you guys next week.
Bye.